Namaste. A subscriber requested me, can you give a scientific evidence on how yoga therapy impacts autism? So I thought of making this video because I want to promote yoga therapy, yoga mudra, how this can impact autism behaviors. Now, this study, what I am going to talk about, is published in 2010. And the authors of this study are Shanta Radhakrishnan, Raghuram Nagaratna, and H.R. Nagendra. It's a short communication and it is a clinical research. The title of the study is Integrated Approach to Yoga Therapy and Autism Spectrum Disorders. This is a very, very interesting study. And in this study, they wanted to look at how autism can be impacted by yoga therapy. Now, autism spectrum disorder, this is marked by abnormal or impaired development in social interaction, communication, and restricted activity and interest in the subject. And there is no specific causal mechanism attached to ASD. So in this study, they wanted to investigate the effectiveness of integrated yoga approach therapy. So they made two groups, group 1 and group 2. In group 1, they gave integrated approach yoga therapy plus they gave applied behavioral analysis, which is a common behavioral therapy for autism spectrum disorders. Second group, they gave only ABA, that is applied behavioral analysis. And they wanted to compare both the groups on various behavioral outcomes. And in fact, 9 behavioral outcomes are looked into. And these behavioral outcomes are in line with the common protocol of observing ASD, that is Autism Spectrum Disorder. And this study, there were 12 children who were diagnosed with ASD. There were 6 experimental, 6 control group. So experimental group was this, 6 students. Control group also 6 children. Very nicely set up. Both the groups, if you look at their ages, it was around 8 to 14 years. So the average age range was around 8 to 14 years for both groups. So it's not that in one group the age range was different than the other. And the setting was where the study was conducted, SGS Vagadevi School, Bangalore, India. And these 3 authors who are quite prominent authors in this field. In fact, Dr. Nagaratna is a MD doctor, and Dr. H.R. Nagendra, he is a scientist, and the first author is an expert in this area and is based in Vagdevi School. And they looked at the outcome behaviors. They gave the intervention for around 2 years. And this is a good study. We need to look. That's why I selected this study. It's a longitudinal study. It's not something like cross-sectional, done it for some 6 months, 15 days, and so on. It's a longitudinal study. That makes this study very, very interesting. And they looked at 9 behaviors such as eye contact, imitation skills, self-stimulatory behavior, receptive and spatial behaviors, and other behaviors. Altogether, they looked at 9. And this assessment was done that means before conducting the study, during, that is mid conducting the study, that is the midpoint, and post intervention, that is after the study was over, it was observed. And the total duration of the study was 2 academic years. That means they looked at this for 2 academic years. So each academic year consists of 10 months and of course 2 months summer break. But during this time, in the summer break, the parents were also helping in the intervention process. And in this study, parents also participated so that this study had a deep impact on the children. Frequency, they conducted 5 sessions a week, 1 hour each, and altogether 82 weeks and 390 sessions were noted. And in terms of the environment, these sessions were held in open, green surroundings. So once you start doing these sessions in an open surrounding or a green surrounding, there is an informal structure compared to doing it in a closed space and so on. So these authors did both control as well as experimental or treatment group, what we call. Both were conducted in an open surrounding. Instructions were 1-to-1. There was a therapist and a parent. Parents were trained to guide home practice so that during that 2 months of continuity of summer, this could be taken forward. And they designed this integrative yoga therapy sessions into 6 distinct parts. And these were designed based on 35 years of experience of these authors, predominantly second and third author. They are quite knowledgeable in this field and they have been researching in this area for a long time. In fact, if you look at some of their studies way back in the 80s, it was published in journals like British Medical Journal. In fact, I remember reading an article on asthma and how yoga can improve asthma somewhere in the 80s. So this study they designed in 6 distinct practices, which consist of warm-up practices, loosening practices, strengthening asanas, calming asanas, some yogic breathing, and at last it ends with chanting and relaxation. So well designed. So the warm-up practices like jogging, light running in the same place. Not that they're going to run for a very vigorously, but a small light jogging for children 8 to 14 years. Then bend forward and backward, hands up, forward, touch the hands and take it up. And the purpose of this design was to prepare the body and improve flexibility and attention. Improve the attention. The next one was loosening practices, wherein they looked at some basic neck exercises like turning the neck in both the sides, up and down slowly, waist bending, waist rotation, then forward bending from waist, and so on. So these are basically, they designed it as a loosening practice to enhance coordination, balance, and body awareness in ASD children. And then they looked at strengthening asana. In that, the first asana, they looked at trikonasana, trying to touch the hand to the leg, keep the other hand straight, and looking through eyes on the tip of the thumb. Similarly, this is done on the other side in 5 to 10 times. Virabhadrasana, what we call a warrior pose. It builds strength and confidence. And this is the posture. Both the hands are touching, or both the hands can be kept straight and taken back. The third asana, what they looked at was Parvatasana, what we call the mountain pose. It improves posture and balance. And if you look at it, the eyes are towards the feet, head down. So this improves the posture and the balance of the child is improved. So these were strengthening asana, what they did. And the fourth one was Sasankasana. This is the sthiti, from the first pose to the final pose and then back. So first you sit in Vajrasana, one leg out, both the legs out, both the hands. Then you go into the Sankasana and then you come out. So this is a pose which encourages relaxation, and also the touching of the hand denotes grounding practice. Then the next protocol, what they looked at was some calming asanas. Simple Sukhasana. You can see here Sukhasana, and then this mudra, Jnana Mudra. This can be done for around, since it's children, you cannot expect them to sit for a long time, but definitely for 2 to 3 minutes, children will be able to sit. Eyes closed, breathing through the nostrils. There is no manipulation of breathing, but rather a breathing with normal awareness. Then the second calming asana was called as Shavasana. It promotes deep relaxation. Lie down like a corpse with hands apart, eyes closed, and in a very relaxed manner. Since it's children, sometimes they don't close their eyes, but it's fine. It's making them to lie down in this posture for some time, in fact, promotes deep, calming relaxation. Then the third asana or calming asana, what they looked at is Makrasana, what we call crocodile pose. It reduces anxiety and also the muscle tensions are removed. Now there are very variations of it. One way is that you keep the hands down and touch the head between the hands and sleep. The second posture is that you keep the hands and on your chin you just rest both the uh, uh, the face, and then this children like this more compared to just lying down with the face down. So that makes them sometimes a bit restless. Here they would be able to look around and see the kids. Then they looked at yogic breathing practices. In that simple blowing exercise on the bubble, rabbit breathing, go in Shashankasana, and then keep the head slightly above hands, and then try to breathe in through the, like how fast breathing is done like a rabbit. Then comes Vyagarasana or Vyagara Swasa, what we call tiger breathing. Go in like a four-leg posture, then take the head back, breathe in, breathe out, wherein the body comes like a concave. Then comes Simha Mudra, lion pose, sit in Vajrasana, both the hands down, take the tongue out and the eyes also as if like a lion you roar. Then Hasta Prasarista Swasa, hands, breathe in and out. So this was the yogic breathing practice. And at last, they looked at chanting and sound practices, whereas they sit in a simple any posture like Sukhasana or sitting on the chair and chant. Then next time oo, and then ma, and then combination of all three sounds together. And this is a short mantra for rhythm, imitation, and calmness in the ASD subjects. Now, if you look at this protocol, it is so well designed that let us look into the protocol once more. They looked at warm-up practices, loosening practices, strengthening asanas, calming asana, yogic breathing, and then followed by chanting and relaxation. So these 6 distinct phases is what these authors called as integrative yoga therapy. So well designed. Now let us see the results. Also, in terms of pedagogy and environmental features, they kept it repetitive, and there was a structure like a personal mat and a personal space allocated to each child. So there is a spatial awareness. Look at the thinking behind the researchers. And there is a gentle touch and guidance by both the therapist in a gentle manner. It's not a hard intervention, but a empathetic and a therapeutic, and a touch dimension is higher. And also parents participated. Somebody who is very close to the child, when it participates, there is a high chance that the child will do this particular protocol. And there is no competitive, that between children there is no competitive, between the demonstrator and the child there is no competition. Because sometimes what happens is that, like, if the demonstrator performs in an optimal manner, because of this his or her years of practice, children feel intimidated. So to avoid that, they kept it very basic. No perfection in these asanas, but rather a demonstrative aspect was considered. And this is important in various studies sometimes, or even in classrooms of yoga, wherein the lecturer or the teacher demonstrates a very good posture and the children get intimidated, and that competitiveness comes in, and then the efficacy of yoga is killed. The key findings was very, very important. There was a significant improvement in the imitation skills, eye contact, sitting tolerance, body awareness, and communication. Now, if you look at this graph here, eye to eye gaze. Now, the one in the dark black is the values or the rating before the study. During the study is what is only white, and the one in gray is post. Now, if you look at here, all the values what is being observed of post, there is a good amount of improvement. And you would see that behaviors like eye to eye gaze, where it was so low, but after the yogic intervention, the change what is observed is higher. Same is the case was sitting tolerance, body posture, body awareness, depth perception and balance, imitation skills, self-stimulatory behavior, receptive skills regarding spatial awareness, and self-injurious behavior has come down after intervening through integrated yoga therapy, compared to only the group which practiced only applied behavioral technique. And all the children who were in the yoga group, after 2 years, they moved outside the ASD defined behavioral range. This is a very significant aspect of this study, wherein both the educators and parents need to consider their role in managing ASD. Parents reported improved interaction at home. So this behavior was not only in terms of 9 behavioral dimensions, but also in terms of improved interaction, what was observed at home, and a sort of a family harmony was also observed. And this authors comes with a theoretical perspective as regards to how did the mechanism of improvement occur in IAT group. And they talked about this concept called as mirror neurons. It's one of the concepts in neurology or neuroscience as regards to how these are activated due to guided imitation while doing yoga. And also it talked about increased self-awareness and calmness, which was achieved through the yoga practice. And in terms of discussion, it talks about how integrated yoga therapy complements the behavioral therapies. So IAYT plus applied behavioral analysis, which were the conventional therapies which was available for ASDs. Now this combination, how it can be a powerful tool for clinicians in dealing with ASD. And yoga is a very safe. Then you have a sense of self-regulation and body of awareness. It can help children to better relate to others. Yes, Every scientific study has limitation. This study also has limitation, like the sample size of only 12, that is 6 in each group, treatment group, another control group. And there is a long intervention period. However, the results are consistent and promising. And if you look at these intervention mechanisms, these are not mechanisms which requires any treatment by drugs, but rather by which parents can contribute to it, teachers can contribute to it, and this can be a tool which educators and parents work together, and of course the behavioral consultants and the healthcare service providers come together in order to develop such an integrated approach. So this was the overall therapeutic outcome in terms of substantial improvement in all 9 behavioral domains, and children in yoga group left ASD defined range, and there is an improved social behavior both at home and family. So this study brings in an evidence as regards to how yoga can impact autism. Though this study is a preliminary study, but it holds a lot of implications for the researchers and also us as a common individual in the society as regards to how we deal with such children who needs special needs. So this video, I know it has gone a bit long, but then I had to make it so that I explain these facets in a scientific manner so that you understand yoga is just not an exercise, but rather a scientific methodology by which various illnesses could be elevated. Thanks to these researchers who have conducted such studies. Thank you for your patience here. Namaste.